Hello, I'm Dr. Lawrence Brown, the Director of the County Health Rankings and Roadmaps program. We are proud to present this special webinar series on the way that communities are responding to COVID-19. Throughout this series, we will lift up the social and economic dimensions of the current pandemic. In addition, we aim to highlight the historical context of place and space to help explain where and why COVID-19 hotspots are emerging. Finally, we will provide a forum for the stories of impacted communities and their innovative solutions that we hope you will share and lift up. We also know that before the pandemic arrived and now, not everyone has had the same opportunity to live a long and healthy life. Story after story in the news media shows the disproportionate impact of COVID-19 in Black, Latino, and tribal communities. This pandemic is shining a light on long-standing inequities that exist in this country because of racism, historical trauma, urban apartheid, and rural disinvestment at every level, designed to create barriers to opportunity that we must overcome. We intend for this webinar series to be an opportunity for community leaders to come together, examine the inequities this pandemic has exacerbated, and explore data and evidence-informed strategies that can enable positive change both during the time of crisis and during the time of recovery and healing. We encourage you to share what's working in your community and learn from others who are also making tremendous strides. Let us work together to build a new nation on the foundation of health equity and social solidarity.
Welcome to Exploring Guaranteed Income as a Strategy to Address Income Inequality. This webinar is the first of our Health Equity and Social Solidarity in the Time of Pandemic Strategies for COVID-19 Response and Recovery series. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We would also like to acknowledge that this webinar series is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. My name is Erica Burrows-Girardi, and I am an action learning coach with County Health Rankings and Roadmaps. Today, I'm joined by my colleague, Lindsay Garber, who is a network strategist with our organization. Hi, Lindsay.
Hi, Erica. I'll be answering your questions today, so please make sure to add your questions to the Q&A box, and we'll ask as many as we can.
Thanks, Lindsay. And I also want to introduce you to some other colleagues who are going to be joining us to help enhance your learning experience today. So let me start with Justin Rivas, who will be chatting with you in the chat box. Hi, Justin.
Hey, Erica. Hi, everyone. Good afternoon. I will be the chat champion, as Erica said. Just a reminder to click the drop-down menu to select all panelists and attendees when you're chatting so that we can see your important chats.
Thank you so much, Justin. And I want to also introduce you to James Lloyd, who is our technologist, who will be handling any technology issues or answering any questions you may have regarding technology. Hi, James.
Hi, Erica. It's great to be here. And again, just send a message to me privately in chat if you have any difficulties with the technology. Welcome, everybody.
Thank you so much, James. Now I want to introduce you to our honored guest, Sukhi Samra. Sukhi is the director of the Stockton Economic Empowerment Demonstration. That is a mouthful, so we're going to use the acronym SEED. But SEED is the nation's first mayor-led guaranteed income demonstration. Sukhi was previously a policy aide to Stockton's mayor, Michael Tubbs. She's originally from Fresno, California, and graduated from Stanford University as a member of Phi Beta Kappa. So welcome, Sukhi.
Hi, thank you for having me.
And thank you for joining us today to share your story, and we look forward to hearing more from you in just a bit. Most webinars in this series are on Thursdays. The length of them will vary, but we know at this time there are multiple priorities competing for your attention. The good thing is that, as always, this webinar and others in this series will be recorded just in case you have to leave early. Today's webinar is just 30 minutes long, so I'm going to move on. I want you to know that County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all, and this includes both how long people live and how healthy they are. The second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where they live or the circumstances they were born into or their income, for example. But not everyone has the same opportunity to make healthy choices. These unequal opportunities create differences in health and don't really come about as on their own or the actions of one individual alone, but they're often the result of policies and practices at every level that have created deep-rooted barriers to good health for some. We see this manifested in things like bank lending practices and school funding based largely on local property taxes. That means that everyone does not have a fair and just opportunity to live a long and healthy life. Our goal at County Health Rankings and Roadmaps is to correct that by offering communities data, evidence, and guidance to take action. The image you see here is our rankings model, and for some of you who've been with us for a while, this image looks familiar. But if you're new to us, bear with me a moment because I really want to explain why this is so important. This model helps us understand what drives health in a community. One of the goals we've always had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens when you go to your doctor's office. It's actually a wide range of factors that influence how long and how well we live. It does include things that we think about when we hear the word health, like eating your 5 fruits and vegetables a day, what we eat, and going to see the doctor and how much we move in a week. But notice that health also includes factors like education and income. Now, when you think about it, it kind of all makes sense. Having a living wage puts you in a position to make healthy choices. But what if we don't have or don't earn a living wage? In November 2019, the Brookings Institute reported that 44% of workers in the U.S. between the ages of 18 and 64 are stuck in low-wage jobs with a median income of just $18,000. So let me say that again. 44% of Americans between the age of 18 and 64 have a median income of $18,000. And then COVID-19 hits American communities this spring. On May 8th, it was reported that U.S. unemployment claims is approaching 15%. That's the worst percentage since the Great Depression. And we expect that percentage will continue climbing. Now more than ever, Americans need economic relief. Could guaranteed income be a solution? Well, that's what we're going to explore in the next few minutes. First, let's introduce you to SEED with a clip from NBC News.
Seen its share of financial problems, but is now bouncing back. The city's embracing a radical new plan that could transform lives. Mayor Michael Tubbs is the architect.
Is Stockton a good representation of what American cities look like right now?
I think absolutely Stockton's a good representation in terms of the promise, but also some of the peril. 23% of our population lives in poverty.
Now, for 125 families, a monumental change in fortune. In February, Stockton kickstarted SEED, funded with private money. The city sends $500 a month on debit cards, no strings attached, to random recipients, chosen from neighborhoods where the median income income is roughly $46,000 a year.
Here are the grapes.
They're betting people like Laura Plummer will spend wisely. Now, nearly a year into it, she says the program's already bearing fruit.
What does an extra $500 a month mean to you?
Woo, it means a lot because seriously, before Seed came along, I was paying a lot of bills and didn't know how I was going to eat.
The grandmother of 9 lives on a fixed income of just $1,500 a month. Simply hosting a family dinner was tough.
I had to ask the kids to put money in. I was so embarrassed.
Can you do that now that you have this money?
Oh, yeah, we've had a couple of real nice dinners since this got started, and they love it.
Laura's not alone, fretting over food insecurity. Early results reveal almost 40% of seed money goes to the dinner table, about a quarter to purchases at big box stores, and the rest mainly on utilities, auto care, and medical expenses. Encouraging news as the push for guaranteed income gains steam.
From day one, $1,000 a month for every American adult.
But this vision for economic equality,
one of the answers, it seems to me, is a guaranteed annual income,
dates back to MLK.
I learned about basic income from studying Dr. King.
Critics counter the money could be misused or dampen efforts to get a job. But in Stockton, Seed Director Sukhi Samra sees upside.
If we're able to give people an income floor of $500 a month, that they're able to take more risks, that they're able to get new jobs if they want to.
Samra says some have already found full-time work, and others,
It's like being able to breathe.
a renewed sense of dignity and empowerment. They're hoping this brief boost takes root elsewhere, giving families the fertile ground they need to thrive. Sam Brock, NBC News, Stockton.
And we want to emphasize that County Health Rankings and Roadmaps does not support or endorse any political party or any candidate. And with that, I want to reintroduce to you Sukhi Samra. Sukhi, Stockton is a city of 320,000 in Northern California. Why did you all decide to pilot guaranteed income? Like what problem were you trying to fix?
Sure. So Stockton, we say, is a city on the rise, but it's also a city that's struggling and historically one that people have run away from rather than to. We were hit really hard by the 2009 recession. We were the first city before Detroit to declare bankruptcy, and the effects of that are still being felt today. 1 in 4 Stocktonians lives in poverty. We're 18th in the nation for child poverty, and our unemployment rates before COVID were around 7%. And we know that this poverty is really at the root of every other issue that we face in this city, whether it be homelessness, high rates of crime, low rates of educational attainment. So we knew that to address this poverty, we didn't want incremental change. We wanted a bold solution that got to the very root of the cause, which is a lack of cash. So that's why we tried to do a guaranteed income in Stockton.
Yeah, and I know that SEED has 3 core pillars: research, storytelling, and community engagement. Let's focus on community engagement for a moment. Who did you engage and in what way?
Yeah, so our core value at SEED is that we are doing research with the community, not research on. So really trying to reverse this historical narrative that cities like Stockton are guinea pigs and the residents in these cities are guinea pigs. So for us, that meant having a really intentional community engagement strategy. In the beginning, when we were still figuring out what SEED was going to look like and who was going to be selected, that meant having listening sessions. That meant hosting town halls, and really going to the residents and getting their feedback on every single aspect of the program, whether it be when they want the money delivered to how they want the money delivered. Now that we're well into disbursements, the community engagement looks a little bit separate. It means that we're going to the community anytime that we share the data. So we have a data dashboard that we launched back in October, and we got community feedback on everything from the colors on the dashboard to how many photos and how many videos we should have on it. So really making sure that the community owns the data. And in addition to that, our community engagement entails stuff like making sure that everyone who's eligible is claiming the EITC, and that we're really trying to share some curriculum with the schools around the history of economic injustice in Stockton.
Yeah, Earned Income Tax Credit, EITC. We love our acronyms in public health, don't we? But, you know, what I really like hearing you say is that the community was involved in every phase of this work. And so even though this project has taken off, and it's a research project, the community is not only benefiting from the economic relief, but they're also part of the research. They're also part of telling that story and sharing the data with other people who want to learn about this. That's so cool. I really like that. So let's talk a little bit more about what that research is showing. So I understand that SEED, unlike other research studies that I've been hearing about, you guys are sharing data along the way. So what are the results showing so far?
Yeah, so as I mentioned, back in October of 2019, we released our data dashboard. It's a public-facing website that anyone can access at any time. And on that website, you can see high-level spending data as well as demographic information. So in terms of the demographic employment information, the first finding is that people are working and the economy isn't. So as you can see, about 43% of folks are employed full or part-time, 20% are disabled, not working, 11% are caretakers, meaning that they're working, they're doing the unpaid labor that most often women of color do, but isn't recognized formally. And 11% were looking for work, but less than 2% of SEED recipients were unemployed and not looking for work. So really countering this narrative that if you give people money, they're just gonna stop working. And despite this employment information, the median household income before folks received the $500 was just $1,800 a month, meaning that SEED was a nearly 30% increase in folks' household income per month. Should be noted that this was all obviously before COVID. And the second thing we saw, the second thing that we saw was that because our recipients are people like you and me, they're spending the money just like you and I would, overwhelmingly on basic necessities. 40% of tracked purchases were on food, 22% on sales and merchandise, which it should be noted includes places like Walmart, where a lot of Stocktonians also get their groceries, and then 10% was on auto care.
Right. Absolutely no different than what my wallet looks like. So SEED has gained a lot of national attention. I mean, we saw the media is actually has paid it some given it much needed attention, in my opinion. But it's actually putting Stockton on the map now, right? So people have heard about Mayor Michael Tubbs, and now they know about you, Sukhi. But have other cities followed?
Yeah, so it's crazy. We reflect on this all the time about how when we first launched SEED, we were like, are we even going to get one piece of media attention? And obviously we've gotten way more than one. And since then, a lot of cities have followed, and we spent a good amount of time just answering and providing technical assistance. There's been so many cities that reached out: Los Angeles, Santa Monica, Glendale, some West Coast cities, as well as some cities on the other side. So we've heard from Nashville, we've heard from a couple of cities in Florida. And what's exciting is that there's also a guaranteed income initiative happening in Jackson, Mississippi, the Magnolia Mothers Trust, where a handful of Black moms are receiving $1,000 a month. The first phase of that pilot happened last year, and now they're in their second phase.
So what we're learning is that guaranteed income is not necessarily something that's so strange and so out there. There actually are cities that are beginning to see this as a potential strategy to address income inequality and address poverty.
Exactly.
Yeah, so it's just, cash stimulus has particularly gained some traction, guaranteed income right now with the public health crisis that we see ourselves in. I mean, the CARES Act, for instance, included a $1,200 one-time stimulus, and a number of congressional leaders are actually calling for recurring cash payments. So I'm curious, based on your experience with SEED, how can guaranteed income cushion against pandemics? What would be your opinion? And does COVID-19 even make the case for guaranteed income, do you think?
Sure. I think as we've all seen over the past couple of weeks, this health crisis quickly evolved into an economic crisis, and the folks who are most impacted are those who are already most marginalized. It's people of color, it's women of color, and it's low-income Americans who even before this crisis didn't have enough savings to weather one single emergency, and now are being thrust even further into financial instability. And I think a guaranteed income really provides folks that income floor and that solid foundation that they need to be able to survive pandemics. And we live in a time of pandemics. COVID is just one of them. It's the one that's most widespread. It's the most dangerous thus far. But we live in a time of fires, of a number of natural disasters. And so we should really be thinking about how a recurring cash payment, instead of just a one-time cash stimulus, which, for most people wasn't even enough to cover rent for 1 month, how can we really make that part of our social contract?
Right. Thank you. Um, I know that there's probably some questions that you may have for Sukhi. In just a few minutes, we're going to open it up to answer some questions that you may have about SEED and this strategy. And I also want to let you know we will be having a discussion group following this webinar. Sukhi's going to hang out with us for a little bit in the discussion group so we can chat a little bit more about this as a potential strategy. So let me share some other information I think would be helpful to those of you who are joining us today. With an understanding of how income can influence health in a community, how can you plan to take action to improve your community's health? This is an image of our Take Action cycle. It's the way that we think about how to create a healthy and equitable community. We believe that community transformation starts with assessing needs and resources, and you'll see that in the upper right-hand part of the graphic, and it moves throughout this cycle to evaluation. Communicate and work together wrap around the cycle because these activities are essential throughout the process. I mean, just think about what you heard Sukhi was saying about how they are in constant contact with people who are involved in the SEED project. So communication is essential if you want something to really gain traction and to be effective. Now you can access tools and resources to help navigate through the steps on the Take Action cycle at our Take Action to Improve Health landing page on our website. A link for that landing page will be included in your resource guide. And also in that nifty resource guide, you will find a helpful resource called What Works for Health. What Works for Health is a tool to help communities make decisions about the strategies that they can use to address local health priorities. All of the strategies and What Works for Health have been assigned an evidence rating. Now we've created this menu of strategies so you don't have to reinvent the wheel each time you want to take action in your community. You can explore strategies by a topic or a keyword search, and you can use filtering options to further refine your results. That's a pretty cool resource, at least I think so. But anyway, while preparing for this webinar and after I saw that Brookings Institute study, I completed a What Works for Health search by using the keywords living wage. And this is what I found. Living wage laws appears to be particularly effective for workers just above or below the poverty line, and they address a root cause of health inequity, which is limited income. So be sure to check out the What Works for Health resource when you get your resource guide. They will be made available to you within 24 hours of this webinar. You'll get an email with it sent to you. So I am going to pause at this point and toss it over to Lindsay because I'm sure we've had some questions that have bubbled up.
We have had a lot of great questions. So I want to start out with one that we've gotten from several folks. Sukhi, could you talk a bit more, one, about how you are funding the program, and then how you were able to engage policymakers and your funder to get that funding?
Sure, so we are fully philanthropically funded. The original $1 million SEED grant came from a group called the Economic Security Project, which is a nonprofit dedicated specifically to exploring how a guaranteed income can help restabilize the middle class. In terms of engaging funders, one, I think having a very bold, dynamic mayor who was attracting a lot of attention helped. And then two, we really tried to lift up the experiences of Stocktonians and to remind folks of the lived experience of those experiencing financial insecurity. So we held a funders convening in Stockton where folks were able to sit in roundtables with Stockton residents who are experiencing financial insecurity so they would know just what they're investing in.
That's great. Thank you. We also got a number of questions from folks about your evaluation process. Questions like, what metrics are you using to evaluate? And then what does success look like?
Sure. So in terms of our evaluation, we're being evaluated by a team of researchers, one at the University of Tennessee and the other at the University of Pennsylvania. And they're taking a mixed methods approach. Our key research question is, how does a guaranteed income impact income volatility? And then how do changes in income volatility in turn impact your physical well-being and your emotional well-being? So we're looking at metrics like income volatility as measured by monthly self-reporting from our recipients, and then psychological distress and psychological stress are measured with questions borrowed from scales like the SF-36 and the Kessler-10. And then we have a host of other scales as well. We have like a confusion and order scale, household food insecurity scale as well. And all of this is included on our pre-analysis plan, which is available on our website. In terms of what success looks like, from a research perspective, I think it's being able to understand yes or no, does a guaranteed income impact income volatility? But because we are more than a research study, for us success also looks like, and it's starting to sort of come to fruition, is other cities replicating a guaranteed income and piloting and finding out what works in what regions and in what cities. And also seeing state and national leaders push the conversation for an income floor for all as well.
Great. And then one more that we've gotten from a few folks is really, how has COVID-19 impacted the program in general and the recipients?
Sure. So in terms of how it's impacted the program, the number one thing is that we don't think it's, we would rather not pull people off in July of 2020 as was originally planned. So we're trying to fundraise to extend the program by an additional 6 months. So we're still in those active fundraising places. And then in terms of how it's impacted our residents are, amongst the most vulnerable populations who are impacted by COVID-19. So a number of our recipients have lost their jobs. A couple of them have actually contracted COVID-19 themselves. And so from our perspective, and from what we've heard anecdotally from our recipients, the $500 a month really allowed people and gave them the income floor that they needed to make it through. Obviously, we would love for it to be more than $500 a month, and people do need more than $500 to weather a crisis, but it's helped provide that stabilizing force that they wouldn't have otherwise.
That's great. Thank you so much for that. Mm-hmm. Erica, are we out of time for questions?
I think so. I'm going to share a couple of more important things with you guys, and then we'll be out of here. The first thing is we definitely want to hear from you. I hope that this has been a good learning experience for you. Justin is going to chat out a link for you to complete an evaluation, but do it later because there's some more information I want to share with you first. So click on that link and save that evaluation for later. But we do appreciate hearing your feedback because it does impact what it is in our process for webinars. So thank you. I want to invite you to join us throughout the summer for additional webinars included in this series. We'll be highlighting the challenges that communities are facing as they respond to COVID-19, and each webinar will be followed by a 1-hour discussion group opportunity, including this one. So in these discussion groups, you will learn from and connect with lead researchers, policymakers, and of course each other. Collectively, we will identify strategies and solutions to help build a more inclusive and equitable recovery. So Justin's going to chat out that information about the discussion group in just a second, but I want to give a plug to our June 25th webinar. So it will be facilitated by our own Attica Scott and will feature 3 amazing health champions, including Dr. Kamara Jones. So I hope that you will come back and join us for the next webinar in that series, and that's going to be on June 25th. Join us for that one or all of our webinars. Remember, they will be recorded, but mark your calendars and be prepared to join us. So again, that discussion group that I was telling you about, we're getting ready to head on over there right now. And so Justin is sending that information out. Joanne Lee with Healthy Places by Design will facilitate that discussion. So please join us if you can. I know Sukhi's going to stick around for a little bit with us. And I look forward to seeing you. I hope that you will be able to make that transition and come join us in the discussion group. And right now I'd like to thank Sukhi, Lindsay, and Justin and James for all of their help today in producing this webinar. And for you out there in webinar world, thank you so much, and I hope to see you again soon. Thank you. Bye-bye.